Can infections cause high CRP? Have you ever wondered how infections might impact your health, especially when it comes to something called C-reactive protein? This protein plays a significant role in understanding inflammation in the body. When infections occur, they can indeed lead to elevated levels of C-reactive protein. C-reactive protein is produced by the liver and its levels rise in response to inflammation. Infections are a common trigger for this inflammation. When your body detects an infection, particularly a bacterial one, the immune system kicks into action. This response can cause C-reactive protein levels to surge, often within just a few hours. Acute bacterial infections like pneumonia, urinary tract infections, skin infections, appendicitis, dental abscesses, and sepsis can lead to a dramatic increase in C-reactive protein levels. In fact, these levels can sometimes exceed 30 times the normal range. This spike indicates that the body is fighting off the infection. Viral infections can also elevate C-reactive protein levels, but usually not as much as bacterial infections. However, severe viral infections such as influenza or COVID-19 can still cause notable increases. Now, how does this relate to digestive health, especially for those dealing with sensitive stomach conditions like irritable bowel syndrome and colitis? C-reactive protein testing can be very helpful in distinguishing between inflammation caused by infections or inflammatory diseases and symptoms from functional disorders like irritable bowel syndrome, which typically do not raise C-reactive protein levels. In the case of colitis, which involves inflammation of the colon, C-reactive protein levels often rise during flare-ups due to inflammation or secondary infections. Measuring C-reactive protein can help doctors determine if symptoms like abdominal pain or diarrhea are linked to an active infection or inflammation. For example, if a patient with colitis has a high C-reactive protein level, it may indicate an infection or a flare that could requiring antibiotics or anti-inflammatory medications. Conversely, a normal C-reactive protein level might suggest that the symptoms are due to irritable bowel syndrome or another non-inflammatory cause. One of the great things about C-reactive protein is that its levels tend to drop quickly once the infection or inflammation is treated. This makes it a useful marker for monitoring how well treatment is working. However, it is essential to consider other factors that might influence C-reactive protein levels, such as medications or chronic autoimmune conditions, to interpret the results accurately. In summary, infections can indeed cause high C-reactive protein levels by triggering inflammation. This is particularly relevant in the context of digestive health, as monitoring C-reactive protein levels can help differentiate between inflammatory conditions like colitis and non-inflammatory ones like irritable bowel syndrome.